Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer and Amazon #1 best-selling author. You can find out more about me and my work at my websites, catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, today we've got a very important guest for you. Our guest today is Dr. Don Dennis. Dr. Don Dennis is an ear, nose, and throat medical doctor, and he is an expert about how mold affects your health. You can find out more about Dr. Don Dennis and his very important work at several websites: microbalancehealth.com, sinusitiswellness.com, and sinussurgery.com. Welcome, Don Dennis.
Thank you.
So, Dr. Don Dennis, this is such an important topic because so many of us who are trying to be healthy are not aware of how much our environment affects our health. And when I'm doing medical intuitive readings, often I identify mold as a primary cause of many people's chronic health conditions. Why does mold exposure make some people sick and not others?
Well, the reason is the genetics. There are two different genetic protocols that people have. One makes them have chronic sinusitis, and that's caused by a T cell receptor defect. And it's one of 8 genes that cause that. And the other one is the inability to excrete the toxins that the mold secretes. So there are 2 different kinds of toxins that mold secretes. One is mycotoxins, of which there are about 400 different ones. And the other one is MVOCs, which means microbial volatile organic compounds. And those are the compounds that will go through a sealed plastic bag that will hold water, or through sheetrock or into wood. And that's why some of the people who have neurological symptoms, after they remediate their homes, still don't get better. So we find that the ones that are sickest, it's best to get in a safe place and not take anything with you to start having really good improvement in your symptoms.
Very important information. And Dr. Don Dennis, let's start by talking and explaining to our audience what is mold. You and I both live and work in Atlanta, Georgia, which is hot and wet. And my understanding is from the US Centers for Disease Control, anytime you have humidity over 50%, you're going to have mold. So, Dr. Don Dennis, from an environmental perspective, what are the causes of mold?
Well, basically, if you get your humidity over 50%, you're going to grow mold. And mold is outside everywhere, especially leaves and plants and straw and mulch. And so when you add water to that, the house breathes by taking in outside air. So the outside air is going to come into the house. The key, though, is to keep the house humidity below 50%. And for the sinuses, you want it between 40 and 50. When you get into the 30s, it gets too dry for the sinuses to function.
Yes, and you know, Dr. Don Dennis, I see so many people make a huge mistake by purchasing very expensive humidifiers for the home to spread even more humidity, and they don't understand. So can you explain for our audience why are humidifiers frequently a very bad idea?
Well, for one thing, if you attach them to the central heating and air system, in most cases, the way they're installed, it causes mold growth inside the duct system, which then propels the fungus throughout the house. So what we have people do is use a vaporizer instead of a humidifier, and that heats the water. And these are individual units. It's not hooked to the central system. And the vaporizer heats the water to steam so nothing grows in it. So that's the cheapest way to humidify the house. in the winter months. There is another way you can do it centrally, but it is a specific way to do that so it doesn't cause mold growth, and that's not something we can explain over this.
Now, of course, a lot of our audience, we are here at the Natural Healing Show for UK Health Radio. So much of our audience is in the UK where it's wet and cold, as opposed to Atlanta where it's wet and hot. What happens in an environment when it's wet and cold? Can there still be the same degree of mold?
Well, freezing temperatures attenuate it or kill it, so you have less when it's frozen. But if it's above freezing temperatures, it's going to be alive, and the wetness makes it grow, and so you'll get more inside. And in most houses, over time, they have mold issues because most houses, over a long period of time, develop leaks in one way or the other. And so, if you don't find out where the leak is, or where the water intrusion is, or moisture intrusion, you're going to always have a high mold count in the house.
So this, what we're talking about with mold, is applicable whether you live in a cold and wet climate or a hot and wet climate.
That's right.
Now, Dr. Don Dennis, you are an expert in helping people cure chronic sinusitis. What actually causes chronic sinusitis?
Well, the Mayo Clinic in 1999 discovered that it is an immune reaction to mold in the body that causes chronic sinusitis. It's a systemic reaction, but what happens is when the mold spore enters the nose, the spore is microscopic, you can't see it. But when it hits the mucosa, and the people who have the gene that is the receptor, T-cell receptor defect, that causes a response of the white cell, which is the eosinophil, to go to kill that mold on the lining. And when it reaches the mold, it explodes, releasing what's called major basic protein. And that protein kills the fungus, but at the same time, it bores a pit in the lining of the mucosa and destroys the cilia. So now you got a pit where the mucus can't get out of the pit. And then the bacteria grow in the microscopic pit, and you get an infection. So typically, doctors just treat with steroids, antibiotics, antihistamines, allergy shots, but they don't address the fungus. So if you try to kill the bacteria, you only get temporary relief. As soon as the antibiotic is over with, this infection recurs. So thus you get chronic sinusitis. So the way you stop it is you remove the mold from the air and from the body. Then you get long-term results.
So in a nutshell, summarizing what you just said for our audience, chronic sinusitis is actually caused by mold in your nose, correct?
Right. And so what happened is that the doctors that don't believe this is the case, they got a group of patients who did not have chronic sinusitis. And of course, they had high mold counts in their nose, but they were not allergic to it, reacting to it. So it's a group of about 20% of the population who reacts to it. Everybody does not. So just because you have no symptoms when you have mold in your nose doesn't mean that's not the cause of chronic sinusitis, because those people do not have the gene.
Very important information. Now, I know, Dr. Don Dennis, many people in natural healing have heard about or are familiar with or have used neti pots, which is a yogic practice of salt water cleansing. So what is your professional opinion of salt water nasal rinses?
Well, you need to add both salt and baking soda to get the best result. And rinsing the nose out is key. It should be done 2 times a day in people who have symptoms. 1 time a day usually doesn't do the job. But the key of the neti pot is not a good thing to use physiologically, because when you tilt your head to the side to let it run out the other side, all the infection goes into the eustachian tube. So you sort of dump all the stuff you want to come out into your ear tube, and then it comes out of the nose. So I don't recommend neti pots. There are other things. There's one called a nasal pure that I like because it's L-shaped. It's a squeeze bottle. But there's another one on the market now for people who have difficulty with manual rinsing their nose out, and that's called a Navage, Navage, and they sell it in most most drugstores, and it's online. It's not very expensive, but the beauty of that is it has two nozzles. One nozzle delivers the salt water, and the other nozzle sucks. So you don't do anything. It sucks it right back into the container, and then you can revolve the you can rotate suction and irrigation, so you can change the side that's delivering and the side that's sucking just by rotating the nozzle.
Great, valuable information. And I am a fan of NeilMed, which is a little plastic bottle with a nozzle that you can use for nasal rinsing. And you had recommended that we use not just salt, but baking soda. So if
And
someone, excuse me?
use both baking soda mixed with salt.
So what is the proportion that our audience should use when they're rinsing their nose?
Well, usually all these devices come with prepackaged salt and baking soda, so you don't have to mix anything. You just dump it in there and shake it up. But if you're trying to do it yourself, it's usually about a quarter of a teaspoon of salt and 8 ounces of water and about the same amount of baking soda. And if it's too salty, you have to cut back. But most of these devices come with the pre-mixed packets, so you don't have to worry about mixing it.
And I'm going to give you a free ad because I am a raving fan and long-term user of a product that is sold at microbalancehealth.com, which is your sinus rinse. I believe it's Citri Drop Sinus Rinse, which helps get rid of the mold in your nose.
You know, Citri Drops is a really important product. It's a natural product, really composed of the citrus seed extracts. And so when you mix 4 or 5 different citrus seed extracts, the result is a exponential improvement in killing everything versus using one at a time. So that's why this is composed of 4 different citrus seed extracts, and you can put it in water to drink it, or you can put 4 drops in 8 ounces of saline and rinse your nose out. So it has antimicrobial properties. It basically is effective on fungus, virus, and bacteria in general, because this is a well-known natural, quote, antibiotic, antimicrobial.
Really important information. Now, someone listening to this may think, well, gosh, I live in the UK where it's cold and wet, or I live in an environment where it's hot and wet. How do I go about cleaning for mold? So many people I know want to pull out a bottle of Clorox or bleach. Why is bleach a bad idea? And how do we go about cleaning appropriately for mold?
Well, first you want to protect yourself, because when you start cleaning, you have all the spores go in the air, as well as the mold and the mycotoxins and the MVOCs. So you want to protect yourself with one of those big respirator masks that has the screw-in filters on it, and protect your eyes so this stuff doesn't get into your corneas. But Clorox itself does not kill mold. It removes it, but it doesn't kill it. And then it off gases, and those gases on Clorox are toxic. So you don't want to use Clorox. So Microbalance has some safer products that are based on citrus seed extracts, and you could actually drink these things and it wouldn't hurt you. They're not to drink, don't misunderstand me, but they're for environment. But we have had people, of course, drink them and they're fine. So somebody's going to drink it, right? So it won't hurt you, but don't drink it. What it is called EC3, and you dilute it into a spray, or we have a fogger that really is a lot easier. You can fog your whole house in 10 minutes by walking around with a fogger. It shoots it out 30 feet, and it goes, you want to mist everything, floor, wall, ceiling, clothing, everything. And it's pretty effective, but it's a Band-Aid, it's not a solution. And then you, of course, you vacuum, and if you're really sick, you can't have carpet because carpet's an uphill battle. It's sort of like having sod on the floor because you can't really clean it microscopically effectively. It puts too many particles in the air for real sick people. So that's not an option to keep your carpet or rugs chronically that you can't, launder easily. So then there's a candle that we have. And the candle removes all the mold and the mycotoxins from the air in a 12 by 12 space in 3 hours. So that's pretty powerful. And then of course you use a HEPA air filter. And the ones I like the best is called IQ Air. We don't sell those, but that has a 0 particle count coming out at 0.3 microns. So there are other HEPA air filters in it. If you can't afford that, get whatever you can afford. It's better than nothing, So HEPA air filters, candles, a spray, or doing the fogger, or you can also, you have to wash your clothes. That's a whole other subject. All the front loader washers have a problem with mold contained behind the barrel, and you can't see it all the time, or it develops underneath the grommet that seals the door. So the best washer in the United States is a top loader, and it's a new model. It's a Speed Queen is the brand name, and they are not subject to all the rules with the water saver. They have a water saving feature, but if you don't want it, they have another setting that you don't have the water saver, which keeps it cleaner, by the way, and gets your clothes cleaner. And then you put the EC3 laundry in there. Now, if you've got really moldy clothes, we pour a quart of the bottle in there and put it on hot water. And then when it starts agitating, flip the lid open and let it sit for about an hour, and then just put on your phone to warm in an hour, and then come back and finish the load. And after that, you don't have to do that again. Just follow the instructions on the bottle, but that ensures that you're killing everything in the clothes. So if you get your clothes and air clear of mold, then the medical treatment is effective. But what I tell patients, the air in your house is like a swimming pool. Just imagine all the air is a swimming pool. So if you're in the swimming pool and you're sitting on the bottom of the pool trying to rinse your nose out and put nose sprays in there to kill fungus, and you're trying to rinse the pool water out of your nose while under the water, you're not going to be successful. And that mind picture is valuable in letting you know if you don't fix the air, you really can't get long-term wellness in chronic sinusitis or mold illness. And that's the most common thing. People who get really sick, they stay in the house, or they move to a worse place and they take all their stuff with them. So you got to get it right. And the simple way to think about getting it right is you're going to a place in which 100% you're getting better. That's the first criteria. Before you test it or look anywhere, you're getting better. And a key point there is there are people, you want to rent something or buy something. Some people require several days before they know they're okay there or they're getting better. So we learned from patients who also had asthma that when they tell the owner, well, I have asthma and I have to determine if I can breathe in this place properly, and it takes me 2 or 3 days to know that. So the universal language in air quality is asthma. Everybody knows what asthma is, but when you try to explain mold illness, everybody just glazes over. So you can't get anywhere that way.
Yes, great. Such important information. And for our audience, I want to add, I'm a fan of molecule.com air filters. So it's molecule spelled with a K rather than a C. And they actually get mold out of the air. And again, going back to bleach, because so many people will go, well, I realize I've got a mold problem. I just want to get rid of bleach. Dr. Dennis said, yeah, it'll get rid of the bleach, But my understanding is that bleach actually causes mold to grow. Is that correct?
Well, it is a chemical that makes it, cleans it off the wall, but it's caustic to the mold. So then the mold begins secreting all of its toxins when you hit it with bleach. So you don't really want to do that. It does clean it, but so does the EC3 products. If you use it full, full strength, it'll take the paint off the wall. You don't want to do that, but it'll clean it in the bathroom or on tiles. It cleans it pretty well. And there are other products that clean it. If you want to just clean it and then treat it with something that'll kill it, that's okay too. But you need to protect yourself. Most people don't use any protection when they are treating mold or trying to get rid of it. They just, it's just like dusting to them. And they get really sick, especially people that try to open their own wall cavity and clean it out. Don't get into the business of trying to remediate your own home, because you really need to establish negative pressure in there and seal off everything else, and then put on like a Tyvek suit and the whole thing to do that. Because it's serious. We have people who have serious long-term illnesses from extreme exposure trying to clean their own house.
Bad idea. Yes. Now, Dr. Don Dennis, how, if someone is aware that they're allergic to mold and that they have health problems related to mold, how do we go about finding a safe place to live?
Well, it depends on whether you want to rent or purchase a house. Rental is kind of easy because if you get it wrong, you can move. But the first step is, like I said before, you have got to determine that you're feeling better in the new environment. Yeah, and if you don't know, you can't tell, that means it's no. Okay, so and that makes it quicker to know if you've got a good place, instead of all these people going in places walking around trying to test them without first determining, hey, I know I feel better here. That's the most important single thing to do. And for different people, it's different times. Some can tell immediately if it's good for them. Others take several days. So whatever it takes for you, determine, I know I'm getting better in this environment, and then do the testing and investigation. But the other point is the central HVAC system needs to be examined, because people who are sensitive to mold, the vast majority of them, is 90th percentile, are also sensitive to fiberglass, because fiberglass is a food source for fungus. It loves fiberglass. It grows very well on fiberglass. So the common thing in heating and air systems is the coil box usually is lined with exposed fiberglass. And over the years, that starts flaking off. And if you look at it in 2 years, it's all black. Now, all that mold is going downstream to the rest of the house. That's one problem. The other problem is they use this stuff called duct board, which is actually metal duct that is lined with exposed fiberglass. And the fiberglass causes submucosal hemorrhages, which are like blood spots inside the sinuses and lungs. So a lot of these people you see walking around with oxygen who never were a smoker or never worked in chemical plants, most commonly it's fiberglass in their airstream that causes the lung damage, like COPD. So your airstream and where your heater is located can't have blown in fiberglass insulation or exposed fiberglass inside the duct system. So that's the other thing you want to look for. If it's got that, you can't have that.
Now, one of the things that I often recommend for people is on Amazon, you can buy a little device. It's an AccuRite indoor humidity monitor. And it costs about $10 and it's portable, and you can go around and move it around different rooms in your house and actually check the humidity. And I've got in my healing room, I've got a little device that tells not only the time, but also the humidity. So I can measure that, because again, so many people are not aware that if the humidity is over 50%, they're going to have mold. So Dr. Don Dennis.
Well, to that subject, there's another one that goes as an iPhone app where you have a humidity temperature gauge, and then it goes to your iPhone wherever you are, because it's Wi-Fi. And so you can put them all over the place, and you don't even have to be home to know what the temperature is and the humidity.
That's wonderful. And what's the name of that app that people can download?
I don't know. You just look up, iPhone app for humidity. It'll come up.
Very important information. And, here in Atlanta, where the outdoor humidity is almost always over 60%,
Right.
I frequently recommend people get a dehumidifier for their home. And my house is 80 years old. So I have a whole house dehumidifier, and then I've got another dehumidifier that services my healing room where I see people in person. So that room can be as clean as possible. What is your professional opinion of whole house dehumidifiers?
I think they're a necessity, especially in the South. I think it's not elective, and most of the newer systems are coming with some form of that. But the sad part about this is they don't have any MD input into the design of these things, or really health experts when they design these systems. So when you have a whole house dehumidifier, if you install it according to manufacturer specifications, it's incorrect for human health. So what they usually do is they suck from the return and then they deliver to the supply side, bypassing the coil. That's the way the book says to do it. That's incorrect for human health. So you want the dry air going directly onto the coil, because in the South, that's what's wet, and that's where all the humidity is. So you want to dry the coil. So you have to check and see if they installed yours correctly, because usually they don't. So that you wanted that coil to be dry, because that's where the mold's going to come from to go in the whole house.
Thank you for that. And Dr. Don Dennis, how important is it for our audience to get their air ducts cleaned? Again, so, people, if you buy a new house or even have an old house, how often should we get our air ducts cleaned?
I'm not a strong component of air duct cleaning, because what you're trying to do is clean microscopic stuff you can't even see. Now, if you've got, you can get this stuff you can see out of there, but it's like a wide variety of proficiency at that job, all the way from awful to really a good job. So it's hard to know which one you're getting. And also, they got to protect the rest of your house when they do that. They need to suck at one end and deliver to another end. And if you've got fiberglass in your ducts, and the way you can tell that is if you have metal ducts, if you see metal on the outside of the duct or the box that all the ducts hook into, if you see sheet metal, that means you have fiberglass exposed on the inside of that duct. So instead, you should see the aluminum foil insulation wrapping around the duct on the outside. If you don't see that, that means you got fiberglass on the inside. So fiberglass, if you got a fiberglass situation, you do not want your ducts clean, because you're going to rip out all that fiberglass, and it's going to come in your airstream. So ultimately, the ducts have to be changed out. The plenum is the big box that the ducts hook into, and that needs to be changed.
Now, Dr. Don Dennis, what is a good diet for keeping mold symptoms in check?
Well, basically the yeast diet, where it's no refined carbohydrates. You're going to eat no bread, rice, potatoes, or sweets, and no grains. And you're going to eat basically all your meats, all your seafoods, all your vegetables, and your fruits only be berries. And then the snack foods that we recommend that really are satisfying is the 3 nut butters, not peanut butter, but almond, walnut, and pecan. And the best manufacturer is Artesiana's, Artisana. That's the best tasting one because there's a lot of those kinds of butters that just don't taste good. This one tastes really good, and you also add Himalayan salt to it. Just open the drawer, sprinkle a little salt in there, and then that's your food that satisfies the need for the carbs.
And for our audience, can you explain? I believe that peanuts and peanut butter is full of mold, specifically aflatoxin.
That's right. But I mean, so it tastes good. And for the most of the population, it doesn't, it's not a big deal. But for mold people, you just don't want to have peanut butter because they can't excrete it very well.
Now, Dr. Don Dennis, so someone from our audience may think, check, I'm working on my environment, check, I'm working on my diet. For people who don't get better after moving or cleaning their environment and taking a lot of medical detox supplements, what is your advice?
Well, there's a list we have on our website. Why don't I get better is the title of that. And so it's the first thing is to consider 90% of the time you're still in it, knowingly or unknowingly. And the way you can tell that for sure is just take a SEA agar plate, and you can get that from Microbalance Health or Immunolytics is the company that sells those things. And just open the mold plate and tap it with the media surface down. Just tap your clothes, 3 or 4 times, the front, the back, and the legs, and then close it. And if you're growing out over 4 colonies on there in a few days, you got a problem. So that's the easiest way to know. But generally, it's people are taking something that is contaminated with them. They're not really thinking through it, or they're taking their clothes that haven't been decontaminated with them. So if you think about it like lice, instead of using the word mold, use the word lice. So your house is full of lice. Like every square inch has thousands, floor, wall, ceiling, clothing, on the counter, on the john, it's everywhere. So first of all, everybody's moving out of there the same day. They're not waiting for a month to see. So all the stuff in the house is full of lice. And so if you think lice, it's easy to know what to do. You can't take it with you. You got to decontaminate it first, or you take the lice into the good place.
Now, you mentioned laundry, and again, I'm a raving fan and long-term user of your products at microbalancehealth.com because I don't know how else to get rid of the mold in a healthy way. Why is it so important to get rid of mold in our clothes and when we wash our clothes with laundry, in the laundry?
Well, you same way with your linens. You don't want to be wearing it or sleeping in it because you got 24/7 exposure when you do that. So if you wash the clothes in EC3 laundry, if you know they're contaminated, we recommend you put like a quarter of a bottle in there on hot water. And as soon as it starts agitating, open the lid and stop it, pause it for an hour, let it soak, and then turn it back on. Then you don't have to do that but one time for those clothes. And then remember the lice parable. You don't want to take the clean clothes and put them back with the dirty clothes that you haven't done yet. So you put them in a plastic bin with a plastic top until you get to all the others. And this is a good time to clean out your closet. All the stuff you're not going to wear, dump it. Don't, because it's all contaminated anyway. And then dry cleanable clothes, dry cleaning does not kill fungus or remove mycotoxins. So that's a whole nother problem. There is a laundry here in Atlanta that has a fogging system that goes through the clothes and then they launder them. But what I tell people to do one, send them one thing and get that back and test it to make sure it worked before you send all your stuff. It's sort of a trial and error thing. And a lot of times you can't fix things. And you just need to give those things away so you don't keep getting contaminated. There's a lot of people who get well and then start going back to their dry cleanable clothes and they get sick again, even though they were laundered, but that chemical doesn't get rid of the mycotoxins or kill the fungus.
So Dr. Don Dennis, you've been talking about mycotoxins. What exactly are mycotoxins and MVOCs?
That's a good question. So mycotoxins are small oily droplets that float on dust particles in the air, and they're secreted by the fungus. And so they're floating around in the air, and they get into everything, and then you breathe them. And then the highest concentration of both the mold and the MVOCs and the mycotoxins is in the nasal mucosa, because it all comes in through the nose. You can have food mycotoxins, but generally that's not a big issue. What's a bigger issue is what you're breathing, especially if you know your house is contaminated. So we find the highest concentration in the paranasal sinus mucosa, and because of that, the fungus that they breathe is making more of them. So they have their own internal manufacturing facility of the mycotoxins in their sinuses. So you have 8 different sinuses. So what we developed is a way to open the sinuses. You go to sleep for this, and it's all done through a telescope. So we open all 8 sinuses, and then we irrigate them with a device called a cyclone. And the cyclone is like a mini pressure washer with a suction on it that washes every millimeter of all 8 sinuses and cleans the mycotoxins off of them and then sucks it away so they don't go anywhere else. And then the results of that is it immediately stops the brain contamination with the MVOCs. And the majority of these people get a huge improvement in their neurological symptoms and their cognitive abilities when they're over this surgery. If they got out of it. If they go back in it, they get worse because now all their sinuses are open.
Now, Dr. Don Dennis, you talked about mycotoxins being little mold particles floating in the air. What are MVOCs?
The M stands for microbial, is microbial volatile organic compounds. Those are compounds like acetone. It's like, you smell acetone, or people used to sniff glue and get high. Well, MVOCs are like glue. So when they removed the glue from their nose, the high went away. Well, the same way, if you remove the MVOCs from the patient, the brain symptoms and neurological symptoms go away. So, but these chemicals are totally different. They will go through sheetrock, into wood, and through a sealed plastic bag that'll hold water. So these are really serious toxins that cause the same symptoms as the mycotoxins, but nobody's pulling those out of humans or really testing them. They have machines that test for VOCs, but the VOCs are really serious, and it's very difficult to get rid of all those in a remediation. So that's why we say in really sick people who have serious neurological symptoms, memory loss, concentration problems, immune suppression, we recommend that they get into a safe place, don't take anything with them in order for the medical therapy to work. Then if they want to deal with a house later, get all that done and then go back in. If you know your symptoms get worse, that means you can't live there. It's a long process, but the main thing is get out of it now. Don't wait a month or two to get out of it.
Now, Dr. Don Dennis, again, somebody who's listening to this program may realize, oh my gosh, this may be, in fact, the root of my health issues. And I know when I'm doing medical intuitive readings, the 2 things that most doctors and naturopaths aren't looking for are actually mold and parasites. So those are big factors that affect our health. Now, how does mold cause neurological and psychiatric problems?
They can be both or one or the other, So the mycotoxins are neurotoxic. That means the toxin actually damages the nerve. And it does it in a lot of different ways, but basically it fries the nerve. The nerve doesn't work anymore. But it's a gradual symptom. You get a little weakness, and then first thing you know, you can't walk. So the muscle doesn't work at all. So it happens over usually a longer period of time. But the way it works is it goes directly from your paranasal sinuses into the brain. And so, and it gets into the circulation. So we find the toxins in the urine. So you do a urinary mycotoxin level. And that means you got mycotoxins everywhere if it's in your urine, not just your brain, but everywhere in your body. So it can get into peripheral nerves, arms, legs, and it can cause tremors, just like Alzheimer's or, all the tremor kind of neurological diseases, and it can be so severe you can't write. And it can cause visual loss, all degrees of visual discrepancy and visual loss. And it can cause hearing loss and ringing in the ear and balance disturbances. So it damages everything the brain does. And it's different for every person, but basically you want to remove the toxins from the air and from your body. Without doing it from the air, it's futile to do it from your body because you're just breathing more of them. So one thing to hang your hat on is you're breathing 2,904 gallons of air a day. And so imagine every day you take out 2,504 gallon jars from your house into the front yard and stack them up. That's to give you a visual picture of the volume you're breathing. So with that kind of volume going through your nose, there's no way you can get well without fixing your air. It's too much volume.
Really important. Now, can you give an example for our audience? You talked about all kinds of degenerative brain problems, but can you give some examples for our audience of clients you've had or kinds of illnesses, kinds of psychiatric illnesses that you've treated that were actually caused by mold?
Yeah, we have several patients that have this. The most common psychiatric symptoms they get is depression and anxiety. And so we've had patients that had no family history or prior history of psychiatric disorder at all, because you can have some that do. That doesn't mean they can't get worse, And so this one lady lived in Canada. She had 2 or 3 kids, and she had suicidal depression and anxiety. And she's in her 40s. And so she had it so bad, she was institutionalized. They tried every drug that's on the market possible for depression. None of the drugs worked. So they shocked her brain 18 times to try to get her out of this depression, and nothing worked. She was considered treatment resistant and bound for institution forever. So she came down to have a visit with me, and first thing she said, she was going to kill herself. And I said, well, let's just see what we can do. Just hold that. Just let's see what we can do. And so we operate on her, and day 3, she had no depression on no drugs and no anxiety.
Incredible.
That's like a miracle. And so that totally changed. There's no hope to can live a normal life if what? She stays out of it, right? You can't go back in, and you can't live or work in moldy places. And most of these patients can tell pretty quickly when they get in a place. So what we tell everyone who's sensitive like this, take a little one of those little squirt balls that you rinse your nose out with in your purse, and take a little nebulization of what we call amphotericin. Amphotericin is an antifungal, and the best nebulizer is called a Rhino Clear Sprint. And so you can get one online, Rhino Clear Sprint, and that nebulizes the stuff in your nose, gets it way back there, and it works in about a minute. So you don't have to nebulize for 10 minutes. So you do about a minute on the side, and then as soon as you're exposed and you know it, rinse your nose out and do amphotericin, and then you won't get sick. If you do it within the first hour, you don't get sick. Now, if you don't have all that, you have to try to use citral drops, which would be better than nothing. It works pretty good. But sort of amphotericin is like the king of the nuclear option.
Really, really important information and life-changing information and life-saving information. You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. Dr. Don Dennis, his life-changing work, you can learn more about him and everything that he has shared with you today at microbalancehealth.com, sinusitiswellness.com, and sinussurgery.com. And remember, if you've been struggling to get healthy and nothing seems to be working, you may be overlooking your environment, which is something that I talk about in my medical intuitive readings. You remember, when you clean up your environment and deal with mold, natural healing occurs. Very important information, and we very much appreciate Dr. Dennis and his contributions to the field of natural healing. Thanks so much for listening, and we'll see you next time.